Madam President, over 2 months ago, I stood here in this chamber urging my colleagues to pass legislation that will prevent kids enrolled in the Children's Health Insurance Program from losing their health care. The Children's Health Insurance Program, or CHIP, provides health care coverage to over 100,000 children in my home state of Michigan and more than 9 million children nationwide. I recall welcoming the news that Senate Finance Chairman Hatch and Ranking Member Wyden had reached a bipartisan agreement to extend the health care benefits for these children. They worked together and they went through regular order. The Finance Committee held a hearing and a markup on the bill in October. We all know that regular order has become a very rare event in the Senate today. And I appreciated the bipartisan effort to have a Senate vote on a bill that is absolutely critical to our nation's children. I certainly expected that this bipartisan bill would come to the floor and pass with broad bipartisan support, thus bringing relief to families across the nation who are worried about whether their children will continue to have health care in 2018. Unfortunately, in the months since those good faith efforts, we still have not seen a vote on this important legislation. Madam President, this is inexcusable. We must take action now. States are already beginning to notify families that their children's health care plans may be canceled. Yes, canceled, if Congress does not act. States like Louisiana, Texas, Virginia, and others have announced that they may run out of funds within weeks. In my home state of Michigan, I've heard from parents who are worried about whether their children will still be able to see their pediatrician next year. I've also heard from pediatricians who take care of these children how children will be hurt if their health care is taken away. It would be unconscionable to rip health care services away from children during the most formative years of their life. It would be unconscionable to put new roadblocks up for families whose children need annual physicals and vaccines before they can go to school. And it would be unconscionable to increase health care costs for working families who are just trying to keep their children healthy and give them the opportunity to prosper. This is not a partisan issue. In 1997, President Bill Clinton worked with a Republican majority in both the Senate and in the House of Representatives to successfully pass the Children's Health Insurance Program into law. That legislation passed with 85 votes in the Senate because providing needed health services to children should never, ever be a partisan issue. The CHIP program has been reauthorized on a bipartisan basis since its inception because it is effective. CHIP is working for our nation's children, and we should be too. Madam President, I urge my colleagues across the aisle to call for a vote on this legislation to extend CHIP and pass it without delay. Let's do what's right for our country's children and families and pass this bipartisan legislation now.